Why don't families seek professional help for their loved one's substance use disorder or mental disorder by way of intervention or any other help for that matter? The reason that happens is because of the family system. What ends up happening over time is the family system dismantles, and the substance user or the person with mental health starts to teach the family how to behave. And the family develops those roles that are not labels or diagnoses. They don't define you. They can be treated and they will go away. But for that moment in time, the substance user or the intended patient hijacks the family. When the enabler starts enabling the one person, there's a trickle-down effect. And that trickle-down effect affects everybody else. And other family roles start to develop, which I'm going to get into in just a little bit. Why families don't seek help boils down to the illusion of control, the fear of the unknown change, and the anxiety associated with the situation. Families would rather stay in the situation the way that it is because it's familiar than to have an unknown stranger like ourselves come in, fix the situation, and then have this unknown ending. I've had families tell us that after the intervention, that was what was holding them back, and that is a common denominator. So why families don't get help also is because there's too many people involved. The more people you include in the decision, the further you get away from the decision. And I'll give you a quick example. We'll get a call almost always from a mom or from a sister. What ends up happening is the person will call us, they're ready to go. And then the family will start bringing in other family members who have been disrupted by the trickle-down effect. And all of a sudden now I've got 5 or 6 or even 10 people with a different opinion. And everybody says, oh no, everybody's on board. That has never been the case. They may be on board with changing something, but rarely, if ever, they are completely on board with intervening. So what ends up happening is you talk to that first person and then they go and talk to the others. And everybody who's affected differently has a different look on what's going to happen. And there goes your intervention out the window. It'll never work. They'll never go. They're never going to get sober. There's always an excuse. And families will make more excuses not to hire an interventionist than the intended patient will make when we get there to not go to treatment. 10 to 1 sometimes. Just remember that. Families make more excuses for their loved ones before doing the intervention than the person will give when we get there to ask them to go to treatment. So when you have this dysfunctional family system, everybody is comforted in their role. And what ends up happening is it's counterproductive to the person getting better.